Hi, friends, and welcome to Let's Talk About Healthcare, a podcast about the challenges and the opportunities, the good and the not so good, and the moments of joy found all across our healthcare system today. And remember, it's up to all of us to make healthcare work better for everyone, one day at a time. We are super excited for today's guest, Ronette Adams-Taylor. She is the Associate General Counsel and the Director of Compliance and Risk at Meharry Medical College. If you haven't heard about them in the news or what they are doing, both for the city of Nashville and on a national scale, they have been doing incredible work to help keep both our country and our local city of Nashville safe, well and informed through COVID-19. And we're so excited to be able to talk to Ronette today a little bit about what that's been like and what her team has been up to. So Ronette, thanks so much for joining us.
Well, thank you so much for having me. It's a pleasure.
So tell us a little bit about yourself. Give us your background, your current role, and what does all that entail at Meharry Medical College? What's a typical day look like? And give us that overview.
Okay, as you indicated, my name is Ronette Adams-Taylor. I am a Mississippi girl who loves to travel, so COVID has kind of put a rough patch on me on that. I have a hodgepodge of degrees, a BS from Alcorn State and a couple of masters, one from Carnegie Mellon and FIU. I got my law degree at New York Law School. So in and out the area. I am approaching my 10th year at Meharry next month. That's hard to believe, but as you mentioned, I am the Associate General Counsel and Director of Compliance and Risk Management here. That falls under the Office of General Counsel. You know, you asked about what does a typical day look like. Yeah, in healthcare and higher ed, there is no typical day, especially in this Office of General Counsel. You know, between 8 to 10 hours a day, it can be spent in various ways. You know, typically it started out where I might spend part of my day reviewing contracts and, you know, drafting and reviewing institutional policies. I could be meeting with students, their faculty member advisors, and to help them ensure compliance for community initiatives they are pursuing. We have a lot of entrepreneurial spirit students, and they love helping the community. So they have great ideas that have moved us in different directions and improved the resources that we provide our community. So I am proud of our students for that, but it could be helping them kind of pursue those ideas and ensuring we're meeting regulatory, whether it be state or federal regulations around those things, to boots on the ground with my team. I'm very hands-on. I try to be as we are conducting compliance and risk audits for our corporate or clinical settings, compliance training. A lot of that was face-to-face, or either providing, updates on data privacy issues or things with our executive team. So that was a typical day. And it was exciting. I wanted to ensure when I left law school that the position that I held was something that I didn't do transactional work every day. So I love the fact that I was in an academic setting. And so no day is the same. I don't always get my to-do list done, but 30%. So that's a good thing. 30%. That's a good day when I can get 30% of that done. So that was the typical day pre-COVID.
So I'm glad you brought that up. Is, about a year ago now is where really COVID hit the news in a national way.
Yes.
And it certainly hit y'all's world as Meharry has been so pivotal in the Nashville response. So that's a typical day. How did COVID change your typical day? And what of that is still continuing today? What was temporary? Sort of talk me through what your early experience was sort of January, February, March last year.
Starting in January, like most of the nation, the word COVID-19, the coronavirus, we heard it on the news. It's like, oh, okay, is it here? It's here. How far will it stretch? Is it something that we have to worry about? Everyone had that thought process. As you know, our president is renowned in research. So it was the front of his mind and a lot of our researchers here, but I don't think we really put pen to paper of how that would affect us on a daily basis. This is not the first virus that has affected the country, but from a global perspective, this is the first one since, the Spanish influenza. So starting at the end of February, we had conversations with our employees who were immunocompromised, and as I like to call them, our seasoned employees, to say, hey, do you guys want to think about working remotely for a few days just to, test the waters? And it may not last long, just a couple of weeks. Just our whole goal is to ensure that everyone was safe. So that started by the middle of February, I would say. And then, boom, March hits, and here we are. And you are hearing conversations that everyone needs to go remote. Everything has to stop. And so what became a typical day for the college, and again, this is a healthcare setting, and not just a healthcare setting. It's an academic science. We're doing research. We're training the up-and-coming biomedical and healthcare professionals. How do we do that remotely? So then became, well, how do we handle this? How do we place the college on a remote trajectory? How are we going to service our patients when patient safety is priority? Telehealth, everyone knew about that. We were doing that periodically through our different clinics, but not as much because, again, you have to think about Meharry. We are here to serve the underserved and underrepresented. And so the population that we served, they were not used to telehealth as the number one priority when they wanted to see a healthcare provider, whether that be medical or dental. And our students, they are on rotation. We have accreditation guidelines where they have to have face-to-face interaction with patients. So how does that work? So the day went about, where do we stand from a federal guidelines perspective, a state perspective, as far as maybe setting up telehealth medicine, being able to communicate that to our patients, setting up a virtual learning for our students. How does that affect us from a compliance perspective? Especially, you have these enabling technologies, but are they compliant? Are they HIPAA compliant? Are they FERPA compliant? These are the regulatory guidelines we have to face. And so how do we remain in compliance with the governing bodies and yet still advocate for both our patients and our students in the most efficient way? We knew we had to, because again, that's what Meharry does. So the days really went to being, how do you manage a completely remote campus when no one's here, but there's more exposure, less people around? What does that look like? So staying compliant in a global pandemic can become taxing. So the day shifted to trying to get together policies and procedures in place with executive leadership, with our deans, and communicating that out to not only our patients, but to our students as well, because they're our internal clients.
Yeah, absolutely. I'm so glad you touched on this. That was my follow-up question is, as COVID-19 became a challenge for the whole college, across the whole campus, what are the factors that made that particularly challenging from a compliance or a risk perspective? And you touched on so many of them already: telehealth and just policies and procedures. So what are the other challenges that y'all had to really tackle, the ones that really stick out to you? And are there any just stories or memories that you're like, gosh, and here's a moment that I'll never forget, in how we solved something creatively, or just a challenge that we overcame? I'm just curious what you would say.
It was important that Meharry be a leader in the COVID testing framework. First, the campus of Meharry, the first centralized COVID testing was here on this campus. And that's important because, one, it's what we do, right? Serving the community. But two, our president was out in the forefront. He had been tapped as a member of the mayor's task force. It was important that we have a a testing site in this community. And because people are scared, many people never lived through this type of pandemic in their lifetime. And when you are dealing with individuals who are often at times overlooked, you need a beacon in the community. So it was important that we as Meharry took that lead. And really what I am proud to say is that our team, the compliance and risk team, were instrumental in those meetings. They were there from a logistic perspective, setting up, determining how the flow should run on the campus, consent forms that were needed, because you have to think about that. You're dealing with people's private data health information. From environmental health issues, how are we disposing of the tests that we were taking? Then you had the students; they wanted to be involved. Were we exposing them from a med mal perspective? What were their risks? What were the risks from our faculty members? So there are a lot of things that we had to consider, and what happens when hotspots break out at Meharry. When you are a center of the pandemic and for its testing, your role, what happens here is magnified because of the current role that we had in the community. So how are we addressing that on a daily basis? So those are things that, we had to think about. I am happy to say that the team worked together. Our students wanted to be involved, so they were there on the ground level with helping at the campus in testing. Our faculty members, they wanted to be involved. So many of them would spend part of their mornings testing on campus and then going into their respective clinics and continuing their work in telehealth. My team, they were the ground runners as well. The ones that got the gloves out, ensuring that the lines were working well from a logistic perspective. And then at night, they would come and do their job, what their job descriptions were. But it was important that we stayed involved just from the exposure level. This could, having a testing site on a campus would bring. And I'm happy to say that because we did it so well, it's amazing how you have so many innovative people on campus. You don't know it until you run into a crisis. But because we did it so well, then we were able to leave the other two sites that the city ran, and they're up and running and they're growing well. But Meharry has definitely played a pivotal role in testing. It's allowed our team's expertise, as I said, to just kind of shine in both of those areas. And I believe having compliance of risk on the front line ensured that Meharry and the city was taken care of with the best interests of the city in mind, best national and industry practices being followed, and displayed our commitment to our service and service for all mankind. As we had hands-on roles in serving our community, we also had to think about reinforcing risk and compliance rules and guidelines that changed daily or changed periodically through the day. So how do we work with that? How do we work with individuals having alternate work days or remote learning? So the threat of a global pandemic is frightening, but I'm glad to say that we have definitely stepped up to the plate and we've enjoyed it. It's tiring work, but at the end of the day, as they say, it's a good type of tired. And we've enjoyed being service to the community.
I want to take that moment just to say really explicitly, as a citizen of Nashville, we are grateful for the work that you and your entire team and entire campus continues to do in keeping everyone safe. You mentioned early on the populations that you serve, but in so many ways you have served our entire city. And so from one healthy Nashvilleian, we're grateful. So thank you for that leadership. We will always be grateful.
Thank you.
I wanted to share, touching on this maybe a little bit broader of the role, and you've mentioned it several times, but something that I've told a lot of stories about and had a lot of conversations about is the role that compliance plays and risk plays in keeping people safe and the direct connection between the two. And so I'm curious as to has navigating COVID-19 at Meharry, has that changed your perspective on that at all? Has it enhanced it? Do you define that a little bit differently? I'm just curious, when you personally, going back to where you started the interview, which was, you wanted your position at a law school and to be able to keep people safe and make an impact, right? And you've certainly done so. I'm curious about whether that has, the way you define that, has that shifted at all as a result of this experience?
I think it has to. It definitely has to. And it has. Meharry has always been a beacon for fighting for the community. And we've been patient focused and constantly working to ensure, the safety of our patients, the safety of our healthcare providers. And that's done on a daily basis. But now with this pandemic, how do we do that in a different environment, especially when we have systems that are always changing. So from a compliance perspective, I go back to protocols and guidelines. That's changed. How are we pinpointing for example, communication with our patients? Again, those enabling technologies are out there, but how are we ensuring those technology solutions are best effective for learning, best effective for our patients and getting across what their interaction with their healthcare providers. These things all come up with risk mitigations we have to think about. How are we measuring those risk mitigations, those risks? Communication is key. I've always felt we have been effective communicators, but that has changed a lot. We have found a cadence as far as our communication is concerned as it relates to change in protocols. There are things, you just think of in your everyday life, you let some things go and it's like, okay, I can handle that now, but you have to be on point these days from a compliance perspective with the change and how the pandemic is going. And so be it updating our policies to ensure all our stakeholders are properly engaged. This is our new normal of using Zoom, our new normal of using Microsoft Teams, of evaluating vendors. And I'm so happy with our collaboration with Provider Trust, just happy in general that we have partners who help us as we navigate vendors that are popping up and whether or not they're on an exclusion list and what does that mean for us? Because that's important. Money comes in and out from a financial perspective, from an operational perspective. Compliance hits everything. It's just not healthcare. It hits, our office sits under as a corporate compliance. So operationally, our policies have changed. How we are viewing data and data security and cybersecurity has changed. We are looking more toward ensuring that we are bringing out more audits, collaborating more with individuals who have expertise in those areas because we need it. As we expand our research and from a COVID-19 perspective as well, we are seeing a collaboration with our other schools, not just in the Tennessee and Nashville community, but throughout. So guidelines have changed and we are trying to quickly adapt to that, but still ensuring that we are serving the underserved and underrepresented. And I think what has happened is we are finally able to show Nashville how well we do this and how well we have done this. And that's how we measure success, is by our helping people.
Yeah. Thanks so much for sharing that. One of the things that you touched on a couple of times was how does, so much of the change that has involved compliance, and that compliance really does touch everything. I'm curious if there's an example of, so I'll back up for a second. So much we hear the narrative of trying to connect HR and compliance as it relates to some employee-related issues. Right. I'm curious of whether as a result of this experience, has your team's compliance relationship changed with other departments in terms of you're now working with folks that you weren't really working with all that much in the past, or has it been pretty consistent? And it's just we're reacting to things as they happen in the world, but it's typically the same folks in the room. I'm just curious about how that's evolved maybe over the last year or so.
Compliance plays a major role in everything. We are often seen as peacekeepers because we help all understand institutional policies. Prior to me stepping into this role, my predecessors established a wonderful rapport with all the departments on the college where, compliance was involved, has been involved in everything that we do, everything that the campus does. So we have always been intermingled with all the departments on campus. COVID-19 just shed a greater light on this. But again, as I said, when I stepped into this role, the one thing that my phone does not stop doing is ringing. and our emails are coming. But I'm happy about that. And the reason why is because it shows that we have had an impact on the Meharry campus, that they know that they want to alert us to any changes. And as the current environment begins these ebbs and flows, that compliance is there to help master our way through, to help provide that advice. So no, we were never just connected to HR. We are connected to every integral piece of the Meharry campus. We sit either on the majority of the committees that are on the campus or have some type of input on the work product in some way or form that comes out of those committees, just because of the nature of compliance and risk. And unfortunately, the climate only is allowing for virtual meetings, but we get the word out via email, Zoom, Teams. So we are mastering this whole remote meeting thing, but we're staying engaged. And that's important, especially in these difficult times.
Absolutely. Just one or two more questions. The first one is, what are some of the moments throughout 2020 in what was certainly a challenging year for all of us, but a year in which Meharry really shined? What are some of the moments that you're most proud of or that brought you the most joy throughout what was certainly an unforgettable experience?
Yeah, there's so many. I think I will go with two. And one's from a community standpoint. An example, there was a moment with a particular person, Nashvilleian, who was in transit, I would say, from a home situation. And she would come to one of the testing sites on a regular basis, but was afraid to be tested. And when you are in the shelters, you have to be tested in order to have somewhere to stay for that night. So for the weeks that she came, she never wanted to get tested. So I think this went on for like 5 weeks. And eventually, just the team's smile and encouragement to her, she finally allowed one of the members to test her. And so that night, she was able to have a warm place to stay. And as well as all of us, the temperature begins to increasingly drop in Nashville starting in February. So I'm happy to know that we have been a beacon in that way, that people see us and feel comfortable in engaging us and knowing that we have their best interests at heart. So that's one of the joys, just seeing the interaction with Nashvilleians and not just the underserved, but all of Nashvilleians. We've seen the compassion of this city. Whether it's encouraging all our testing site employees, our temp workers by bringing coffee or donuts and encouraging us along, that has brought me joy. Just hearing that, oh my goodness, I've heard so much about you guys. I'm so happy to see that you all are out here, or your students are doing an excellent job. When you hear about the students, it's like a proud parent. Oh, wow, thank you. They've gone out without us and they're continuing to shine. So that brings me joy. I think the other thing that's brought joy is really, again, Meharry's how we look in the community. When Dr. Fauci and Dr. Hildreth met last week with the summit, one of the important things about that event is something that we knew firsthand, and that's the disproportionate disparities of vaccines in the underserved and underrepresented community. we're considered the most vulnerable, right? But the challenges that Meharry or that the minority or African American community have faced is not having vaccinations or vaccination distribution area in that community. So there's not been a place since December that a vaccine distribution area for the underserved. And Meharry is changing that. We are shining a light on that. And so that was important to highlight that on the front end. So history from now, when our children, David, are in the history books, that's not going to go unnoticed. That's something that we stopped at the beginning. We noticed things, and the summer was a big part of making sure that there was an active voice for that community. So Meharry's active voice on us mandating that Meharry become a vaccination center was important. It's also important that Dr. Hildreth is on the White House task force. So we're moving that conversation along so that those who have not been seen or have been overlooked are now being seen and are getting the services that they need. So that brings you joy. It brings you joy to know that you're doing something to move the needle, not only in that community, but globally as well, nationally, and people are taking notice. So
absolutely, it's history changing and world changing for sure. So thank you for your leadership in it. The last question I have for you today is a bit of a lighter one, which is what are you currently reading? What brings you inspiration? What's on your bookshelf? Anything that's bringing you inspiration these days that you'd be willing to share?
Look, nothing philosophical. Whatever my 8-year-old is currently reading in his chapter books, I think now is the Greystone Manor, The Secrets. I have, and after years of being in school, I want things light, but I think I'm now in the middle of 3 different books, depending on what I feel like for that day. I'm reading The Panther in the Hive by Olivia Pope. I don't know. It's easy reading. And some days when I feel like I need to just talk to a girlfriend about everything, I'm reading Becoming by Michelle Obama. So it really depends on how I'm feeling for that day. But that's what's on the bookshelves at the Adams-Taylor household. But what is inspiring to me is that the impact that Meharry has had on the community via our COVID testing. We've shown the community that we are here for them, not just, again, the underserved and underrepresented. We've shown the Nashville community that we're here for them. From a regional and national perspective, again, long days, but it's a good tired, and I wouldn't have it any other way.
Ronette, this has been absolutely incredible. I am so grateful you chose to spend a couple of minutes with us and just to hear your story and just to be able to continue to shine a spotlight on the incredible, life-changing, world-changing work that you and the entire team at Meharry continue to do. So thank you so much for spending the time. And we absolutely look forward to continuing to amplify all the work and all the education and everything coming out from your team. It's been an absolute pleasure, so thank you. Thanks for listening to this episode of Let's Talk About Healthcare. Remember, it's up to all of us to make healthcare work better for everyone, one day at a time. Catch you next time.